Systemic lupus erythematosus, or SLE, as I'll be referring to it from now on. What is it? It is a chronic autoimmune disease that mainly affects women. It will also affect multiple organs and tissues within the body. Since it does affect so many different organs, it's really hard to pinpoint, and it can be brought on by really anything. It even can present itself as a different disorder to begin with. So how are you diagnosed then? To be diagnosed, you need at least 4 of these 11 criteria to be formally diagnosed with it. Also, blood tests can help move along a diagnosis to help look for some of that criteria as well that is in your blood. But these are the typical ones that will make it easier to be diagnosed. And then the sooner you are diagnosed, the sooner you can start treatment and hopefully prevent some organ damage that is being done. Unfortunately, with chronic disease, you have to be on that medication pretty much for the rest of your life. And most medications right now, long-term effects are kind of unknown. And even then, effects of it going on short-term can cause more damage than the side effects that you already get with SLE. Some of the side effects you will see are cardiovascular disease, dyslipidemia, which is pretty much unbalanced lipid levels, and in people with SLE, it is higher LDL levels and higher triglycerides, and low HDL levels, which is a huge problem. Like I said, medications also affect that. It makes it actually worse. But on top of that, you get fatigue, obesity, and possibly type 2 diabetes. All of these on their own, without SLE, are treated with just watching your diet. So it would just make sense to use nutrition therapy with SLE patients. And what's been suggested is, a low-calorie diet to help fight obesity, polyunsaturated fatty acids to help with, the dyslipidemia. Along with that, antioxidants can also help, and just looking for proper minerals and vitamins, and of course finding a good balance with protein and fiber, which can all be helped if we could focus on nutrition therapy for SLE patients. It can greatly benefit their lives just by focusing on what they eat. And a study's been done to show that if you sit them down and put them in nutrition counseling, even just for 6 months, to teach them how to properly work with their diet and how that can benefit their disease, it will greatly improve their lives. A study's been done to show that. And this paper will go more into detail about that, but it just goes to show that, if we can educate ourselves more on diseases like this and what they do to the body, we can be out there improving the lives of others with autoimmune diseases like this. And here is my long page of references if you are wondering where the information in my essay does come from.